Hi, Keeleyans. I'm Melissa Swank, your KeeleyLife coach. Thanks so much for joining me for a moment. We're here talking to Dr. Joe Sass, or we're going to call him Dr. Joe. He is the head of Gateway Chiropractic. He's been practicing for over 16 years in St. Louis, went to Logan University here in St. Louis, and has been a vital part of the healthcare arena in this area. We're so lucky to have you.
Thanks for letting me do this with you.
Of course,
This is
I'm
fun.
so glad I have a chance to talk to you.
Yeah, it's good.
So I wanted to have this conversation and be able to have this conversation in front of Keeleyans because I think chiropractic is sometimes a little elusive. People really don't know what it's about and what it involves. Can you give us a picture of what it is?
I think you're absolutely right for that side of the fence, because in our easy metrics, we argue about this all the time.
Yeah.
Anywhere from 9 to 14% of the population actively sees a chiropractor or has seen a chiropractor in the past, versus like our usual, like when we get up, we get our checkups, we grow up, we go see Dr. Brown, you know, we're very included in the medical model of things, not so much the alternative medicine style of things.
Yeah.
And so where chiropractic falls in is it falls into the more alternative medicine where sometimes medical just patients want other alternatives nowadays. Mm-hmm. We fall into that piece of the puzzle.
Excellent. So when you say other alternatives, can you give me an example of someone who might find chiropractic really beneficial?
The biggest piece of the patients that come in, they come in because of pain.
Now, are you talking acute pain or chronic pain?
Yeah, so that's the big question.
Okay.
It's that they have positives and or negatives when that pain kicks in, whether that negative is preventing them from doing something positive or that negative is something that it's just like, we had somebody earlier this week, I'm 73 years old. I've got a full life ahead of me that I still want to live. You got to fix this so that I can do what I want to do with my life. So that's why people typically come in. Yeah.
So it's not only to sort of fix some acute pain, but it's really to help manage chronic pain as they go and make sure that they're able to do the things that bring them joy.
It's both. Yeah, it's get me out of this pain now, prevent that pain from ever coming back.
Oh, I love that.
So it's a full-sided avenue.
Okay.
Yeah.
Now, do people come in and see you once, or do they come in and see you a bunch of times? What does that look like, the relationship you have with clients?
The patients that we typically get to see are the ones that have typically gone through the mirage of other medical options. Mm-hmm. And while we love the medical doctors we coordinate with and share, oftentimes that's the referral that we get in. Be like, I've already sent Bob through physical therapy. I've already done injections. He's on the schedule already to have surgery. Mm-hmm. And that patient's like, I don't want to get cut. Like I've seen friends that have gone this route. I don't want to do that. Can you help me? And just so those are the type of people that we're typically seeing.
So you really offer a less invasive option for people
Mm-hmm.
that are not looking to go under the knife.
Right.
I love that.
That's what we're doing.
It is scary, especially when you're talking about something involving the spine.
Mm-hmm.
And I have spoken to people about chiropractic, and sometimes the remark is like, ooh, that makes me nervous.
100%.
Right?
It's because it's new, right? I mean, I remember when I was a kid going to the doctor to get my vaccines, to get my shots, right? As a kid, we're like, mom's just dragging you in because there's a lollipop at the end. Like, if only I can focus on that sucker at the end. Like,
Maybe you should be giving out suckers.
Listen, we've got a great candy bowl up front.
That's great.
And I tease all my patients, like, I'm going to start selling you insulin at the end of this all. And they kind of laugh, but it's like, so yeah, like, are there positive incentives to this? And your question was, where's that fear? The fear is what's going to happen if you don't make a change. Mm-hmm. I think that's the biggest obstacle that patients have to get around. In our office, we do plenty of very safe and effective light adjustments in the office. Mm-hmm. We have a great reputation for taking care of post-stroke patients in our office too. Where you would think like, well, hold on a second, nobody should be working on them, nobody should be touching their spine, working on their nerves, working on their neck nonetheless. Well, we have safe and gentle adjustment techniques that are effective, they get results, and we keep them alive. That's
Yeah.
the biggest piece of the puzzle too. So it comes down to making sure that you examine. You got to be a doctor. You have to examine your patient first. You have to do what's best for them. You have to do what's going to be effective for them, and you have to have a plan. If you don't have a plan, it don't work.
Yeah.
It don't work. So you have to have a plan. So for those patients who are nervous, we say, let's see what this plan is going to look like first before we jump into anything. And they say, oh, you actually took the time to outline every step of this process for me. Well, yeah, because you want to know what's going on. I want to give that to you.
Yeah.
And it's different.
And it makes people feel more comfortable knowing that their plan is tailored to their specific needs.
Absolutely.
So if I've never done this, can you explain a little bit about what it feels like to be adjusted?
Well, I get adjusted once a week without miss.
Okay.
I could twice. I could probably use, as physical as my job is.
Right.
But I'm a once a weeker. Like, I can't go without it. Like, I've been doing it this way for years. And, I'm very biased on that side of the fence too. It's like owning a chocolate bar factory and be like, tell me how good chocolate is. It's just like, come on, it's fantastic. Why would you miss it?
So it feels good. Where someone who's trying this for the first time shouldn't be worried that it hurts at first and then it'll feel better later. It should actually feel good when it's happening.
So we're getting into the dynamics of how physically the body works.
Yeah.
So I think that's a deeper question. Yep. Oftentimes there could be soreness as we're changing how the body works. So if you got somebody who's walking in like this and they say, Melissa, listen, I don't want to walk like this anymore. You say, great, we can get you there. But you realize that I have to retrain all those muscles that have been that way for the past 5, 6, 7, 8, 9, 10 years. They have to learn.
Right.
It's like learning a new workout again. And then, yes, we'll get the old lady hump out of your shoulders. So every piece of this puzzle has to have a learning factor to it. But yeah, we do things to help mitigate the amount of discomfort that the patients are going to be involved in. Absolutely.
Yeah, that makes total sense. We have a very large population of people who are very active and work in the field with their bodies and are constantly putting stress on their joints and their spine and their bodies. So I would imagine that population might already know what it feels like to feel the strain of change on their bodies.
Yeah. To that point, and this is going to be a very unique paradigm. Pain and discomfort are very comforting when you add time to that factor.
Interesting. Tell me more about that.
You can count on the fact when you get up in the morning that you're going to have that sore back.
Right.
And if it goes on for such a period of time, it's a constant, right? We have to get people's mentality when they've been stuck in this rut for such a long period of time, when they've been out in the field, they've been sitting at a desk, when they've been in this own predicament, that the paradigm can shift. You can have better, you can have more. And oftentimes we're preaching hopes and dreams. We're saying, if you just drink more water. Yes, but I love me some draft Pepsi. Like, give me a damn draft Pepsi, right? Well, listen, it takes that leap of faith sometimes. So for those people in the field who know try something different. What do you have to lose? And I'm not specifically saying go to your chiropractor tomorrow, which you probably should anyway. But what if you made sure that you scheduled your stretches and just had them on your calendar and just did them anyway?
I like that concept that you were talking a little bit about what do you have to lose? And it sounds like what you have to lose is a lot of ongoing chronic pain, discomfort, waking up with not feeling good in your own body. And what you have to gain is whatever your goals are. So if your goals are to make that pain go away or do an activity that brings you joy that you aren't able to do right now, a lot of that is more accessible when you are seeing someone like a chiropractor.
Well, so that's really beautiful because oftentimes I don't get to feel that piece of the puzzle because I just want to look at patients that are stuck in the mud and I just want to smack them and be like, just please do something different. It doesn't specifically have to be chiropractic care. Go get a massage. Go get a salad instead of a burger. Go do acupuncture. There's no reason that we can't have a healthier society. There's no reason. The amount of opportunities that are out for us. And we briefly talked about mental health earlier. Like how many, go online, go to BetterHelp, go talk to somebody. The resources are unlimited for us here as Americans. We can do whatever we need to do, but you have to be willing to take that risk.
Yeah, that first step.
That first step.
It sounds like I almost hear a little bit of challenge to Keeleyans today, and I'd love to propose that to all of you, that maybe just do one thing. So if you could tell Keeleyans to do one thing today, what would it be?
For those of you who are on that percentage that don't actively see somebody to take care of your spine, chiropractors are perfectly trained and educated to do the best work for your spine, to keep you active, healthy, and functioning for the long haul. Do some research on it. Just do some research on it. That's all I ask. And we know now that for those in the field, you have to specifically take care of your back, otherwise it's going to fall apart. $100 on the line every single time. It's going to fall apart unless you take care of it. What happens if rust gets on a piece of iron and it keeps going? It never gets fixed unless you sandblast it, reseal it, or weld another piece back on it. You can't do that with your back. So my challenge for everybody today is take a positive step for yourself. Don't sit on the sidelines. Do something. Don't just sit there.
I love that. And I think that goes right along with what we challenge everyone to do with KeeleyLife. Our 4 key pillars are mental health, physical activity, healthy eating, and financial literacy through that HEAL pillar acronym. And I think it could be a really great way to say, choose one of those things. Let's even go bigger. Choose one of those pillars and take one step. Do one thing that will help you improve your life and help you become a better you. Dr. Joe, thank you so much for coming today and talking to me a little bit about this.
Of course.
It's been fantastic.
Of course. Wait, we can't leave.
Oh, yeah, go ahead.
We can't leave.
Okay.
You had a really specific question that you wanted to ask.
I did.
Okay.
I wanted to ask.
Okay, go.
Is it okay if I crack my back?
No, it's not okay that you crack your own back. So here's what's happening.
Yes.
When you crack your own back, you're moving hypermobile segments already. So if we see the bones are stacked on top of each other, right?
Yep.
You're just cracking the one that's already pre-moving. And what happens when you do that is you get a release of hormones in that area, dopamine, that lets it feel good.
Yes, I know that feeling.
Yeah, right? But what's really happening is the bone either underneath or on top of that is the one that's stuck. So when you get all those chemicals overriding that area, it floods the area. So it's thinking that it's moving, but it's really not.
Oh, interesting. Okay, so we're maybe not doing as much good as we think we're doing when we crack our back.
And what happens with that on top of it is the body is smart. It says it's hypermobile. So what do we do with an unstable stud? What would we do for an unstable stud in a house?
Brace it.
Yeah, brace it. The body braces stuff with concrete, AKA arthritis. So the more you want to crack it, the more unstable the body thinks it is, the more arthritis grows in that area, and then eventually they fuse themselves together for protection.
Okay.
Because the body always wants to protect itself.
Right.
So number one, should you not? No, that's my job. But number two, that's the reason behind it. You want to make sure that your body's actually functioning like you need it to.
Okay.
It comes down to neurologic efficiency.
Awesome. Well, that's good to know. And I'll try to stop doing that as frequently.
That your body will thank you.
It will. It will.
It's a weird, that's a reading rainbow way to say that. But yeah, you're welcome.
Well, thank you so much, Dr.
Of course.
It's been so much fun.
This has been great.
Thank you. And to Keeleyans, please make sure that you do something for yourself today and every day as you work toward becoming a better you. Thanks for joining us.
Okay, bye.